Review the abortion laws in your country. Under the Abortion Act of 1967, abortions are legal and can be performed at or before 24 weeks of pregnancy in England, Wales, and Scotland. The laws in Northern Ireland are different than the rest of the UK. Abortions after 24 weeks are only permitted when the pregnancy poses a substantial risk to the mother or if there is significant evidence of fetal abnormalities. Two doctors must agree that it is in the patient's best interest to terminate the pregnancy. Use the National Health Service. The UK's National Health Service, NHS, provides free medical care to citizens of England, Scotland, and Wales. Abortions are free at NHS clinics and hospitals. Your medical history and procedures are kept confidential. Your doctor or professional at a sexual health service will refer you to a certified and licensed NHS clinic or hospital. Opt for services at a private clinic. If you wish to terminate the pregnancy as soon as possible, seeking care at a private clinic may be the best option for you. You will most likely have a consultation and the procedure within 1 week. Details concerning your health and the procedure are confidential. The cost of an abortion at a private clinic can range from £400 to £800 or more, while a later term procedure can cost around £2,000. Review the abortion laws in Northern Ireland. The abortion laws in Northern Ireland are different than the rest of the UK, and termination is only permitted in very specific circumstances. An abortion is only permitted if the pregnancy poses serious, permanent damage to the mother's life or mental health. In Northern Ireland, rape, incest, and fetal abnormalities are not sufficient grounds for obtaining a legal abortion. In addition, abortions can only be performed at or below 9 weeks of pregnancy. Travel elsewhere to receive an abortion. Although Northern Ireland has stringent abortion laws, it is legal to travel to another country in the UK to have an abortion. In 2014, 837 women were reported to have traveled to England from Northern Ireland to receive an abortion. Evaluating the cost of an abortion outside Northern Ireland. Although a resident of Northern Ireland can travel to the rest of the UK to have an abortion, that does not mean that they will receive free medical care under the NHS. If you live in Northern Ireland, you will have to pay for travel, accommodations, and the cost of the procedure at a private clinic. These expenses can total around £900 or more. Get a referral from your doctor. The Abortion Act of 1967 mandates that abortions must be carried out in a licensed hospital or clinic. Schedule an appointment with your doctor to discuss your options for terminating a pregnancy. Ask to be referred to an abortion service or clinic in your area. Visit a sexual health clinic or a genitourinary clinic. You can be referred to a licensed abortion service or hospital by visiting a sexual health, contraception, family planning, or genitourinary clinic. Doctors at these various clinics will be able to review your situation, offer sound advice, and refer you to a clinic or hospital close to you. Contact an abortion service directly. The major private abortion services in England, Scotland, and Wales include the British Pregnancy Advisory Service, Marie Stopes UK, and the National Unplanned Pregnancy Advisory Service. Contact these services directly to discuss your eligibility and your termination options. They will also be able to direct you to a clinic in your area. The British Pregnancy Advisory Service is a leading, independent service in the UK, with over 70 healthcare clinics. Receive a consultation. After you have found a licensed clinic or hospital, schedule a consultation to make sure that the procedure is legal and safe. The consultation is confidential and can last about 2 hours. You will have a medical assessment with a healthcare professional during the consultation, which will include an ultrasound to determine the length of your pregnancy, a blood test, and a STI screening. The healthcare professional will also discuss your abortion treatment options based on the length of pregnancy and your medical history. Decide to take the abortion pill. The abortion pill, or mifepristone, terminates pregnancy by blocking the hormone progesterone, which breaks down the uterine lining. This pill is given to you at the clinic. A second pill called misoprostol is inserted into the vagina. You can do this at home or return to the clinic to have a healthcare professional insert it for you. This makes the womb contract, which causes cramping and bleeding. This treatment option can be used up to 24 weeks of pregnancy. Choose a vacuum or suction aspiration method. This surgical method can be performed up to 15 weeks of pregnancy. You will be given a tablet before the procedure that will help relax and widen your cervix. You will also receive a numbing agent that is injected into your cervix. A tube is then inserted into the womb and the pregnancy is terminated by suction. The procedure lasts about 5 to 10 minutes, and most women return home after a few hours. You may receive a mild sedative during this procedure. Select a dilation and evacuation method. Dilation and evacuation, DNAMP. Is another surgical abortion method that is similar to aspiration. This procedure can be done after 15 weeks of pregnancy. During this procedure, your cervix will be dilated and you will be under sedation and general anesthesia. The pregnancy is removed with forceps that are inserted into the womb via the cervix. The procedure typically takes 10 to 20 minutes, and some women return home the same day. Learn about the side effects. After an abortion, you may experience cramps and vaginal bleeding. Light vaginal bleeding can last up to a month. You may experience nausea and diarrhea after receiving anesthesia or sedatives. If you experience severe pain, a fever, heavy bleeding, smelly vaginal discharge, or ongoing signs of pregnancy after an abortion, contact your doctor or the clinic helpline. Find a support group before or after an abortion. Deciding to get an abortion and undergoing the procedure can be a very difficult, emotional, and complicated situation. It is important to have support throughout the process. Your doctor or clinic can refer you to a therapist or a support group. Many abortion clinics provide in-house professional therapists who will offer unbiased emotional support and understanding before, during, and after an abortion. Many clinics also offer 24-hour support services online or over the phone.